My name is Dylan. I'm a male to female transsexual. I am also bisexual. I am Asperger's. I am Asperger's dyslexic, blind, and in a wheelchair, and I have non-epileptic seizures. I'm a musician and filmmaker, and I have a BA in history. I am also pursuing the rabbinate. During my undergraduate, I spent a lot of time studying. I spent a lot of time studying the history and culture of the LGBT rights movement from a classical liberal perspective. This video is not a substitute for medical advice. This is a retelling of a personal event, not an endorsement of any treatments of gender dysphoria, serious mental health issue.
My name is Margot. I'm a biology student. I have cerebral palsy. I have always been a strong ally to the LGBT community.
In my early 20s, I knew I had gender issues because the hippie persona I presented to the world was something I was growing out of. So I asked people in the disability community and the developmental services of which I was under what to do about my gender and sexuality. It took me a few years. In the world of disability in New York, you are assumed to be straight or asexual by default. The majority of the time when I brought up my gender issues, I was told to go to therapy in a way that implied I should be converted to being. My gender issues got to the point where I could not take it anymore and I would not live much longer. I met my first trans person at age 20. At this point, I decided to pose these gender questions to the only social media site I had access to, YouTube. It turned out there was a thing called transgenderism. I started researching gender dysphoria by researching both male to female and female to male trans individuals. I also researched detransition, which I highly recommend to people who are new to transitioning. After talking to the trans community in New York, I realized after talking to the trans community in New York, I needed to get a diagnosis of gender dysphoria. According to the research I did at the time, I had to make a case as to a reason why hormones were right. Otherwise, I would not be able to get hormones. In order to get a gender dysphoria diagnosis and get hormones, which I didn't have at the time, worth noting that WPATH, as it turns out, allows me to not have a diagnosis to get treatment. At the time, I figured I needed a diagnosis. It was not clear where to get hormones or where to get a diagnosis and who would be in charge of prescribing the hormone. I asked around the developmental disability health clinics to see if they knew anything, just trying to figure out how to get information. I asked around the developmental disability health clinics to see if they knew anything, just trying to get information to see how to get diagnosed with gender dysphoria. At this point, I decided I needed to do some proactive thing. At this point, I needed to do some proactive things like go to a mall to try on dresses, which I enjoyed. And in Boston, I used the female name. Upon this, I plan to use it as evidence, get a letter for hormones, and a gender dysphoria diagnosis. I felt time was of the essence because my dysphoria was getting worse. I spent time in the LGBT community where I was out as gender questioning, but I was in the closet in other spaces, which made my mental health worse. I found one psychologist that was willing to find me a special, who dealt with gender and sexuality at a DD clinic. Once I met this person, I thought it was my job to convince him that I was trans. So he would write me the letter for hormones to treat gender dysphoria. And when I was first diagnosed, I got multiple opinions, which I highly recommend to anyone with a gender dysphoria diagnosis. After going back and forth with developmental disability clinics, it was clear that they would not be providing hormones because they do not want to provide LGBT health care of any sort. When I went to my first LGBT clinic, they didn't, it was an utter culture shock. The LGBT clinic was only interested in three things. The first thing was my sexual orientation. The second thing was my AIDS status. And the third thing was my gender identity, as well as a multitude of woke factors like race. These issues are not discussed in the developmental disability community at all. And because I was transsexual, they assumed I had a history of sleeping around or a history of being a prostitute. The LGBT clinic was interested in mental health, which was good. They ignored my bipolar, but they wanted to appease my gender because they thought I was going to commit suicide, which was scary. Even though I went to these clinics to get hormones, I was constantly being pushed to take PrEP. I didn't even know what PrEP was. Another thing that was interesting was I always had a nurse practitioner, which made me nervous from the start. I started out the questions after the usual questions at a doctor's office. I asked her what her experience was with developmental disability and autism. I asked her how my hormones would affect my autistic brain. She said she did not know, but that she would be there for me with any concerns regarding impairment, and she would try to help. She gave me a brochure on the effects of estrogen and Lupron. She gave me time to go home to show it to others I knew and get advice from others who were trans. I was given a blood test before I left the office. After I got as much input as I could from those around me, including other trans people, I decided, considering I could not find any information on how hormones would affect my brain and my dysphoria was getting worse, I decided some treatment was better than none, where I signed the consent. The nurse practitioner did address one access barrier of my inability to swallow pills by giving me patches.
Hormones can be made artificially and taken in a number of ways. The estrogen patch is supposed to be absorbed through the skin and applied each week.
I was supposed to start estrogen and Lupron at the same time, but insurance needed pre-authorization. So I took estrogen without Lupron for about 3 to 6 weeks. When I first started taking the patches, which I put on my back, which uh when I first started taking the patches, it went well, nothing of note. Uh I became fixated on the chests of Robert Plant and Jim Morrison. 1 week after I started estrogen, I ended up going on a hike in the Hudson Valley, which was supposed to last an hour, but ended up lasting 6 hours and was poorly arranged. This wasn't good for my fatigue from Lyme disease. I highly recommend watching my Lyme disease story for more information regarding that. I do not recommend doing anything strenuous when first taking estrogen. I now know I have neurofatigue and was not on blockers. I don't suggest doing what I did. After 6 months of being on patches, it became apparent that they were a huge logistical inconvenience. And there was a chance due to my dyslexia, I was not using them properly. There was a, at this point, in consultation with my medical provider, I was prescribed estrogen injection.
Estrogen is an intramuscular injection that is injected into the thigh. It has a higher dose than the patch. After a week, it wears off and must be injected again.
Although I was prescribed a vial of estrogen from the pharmacy, I never actually took the injection until 6 months later. As far as the trans community, All as far as the trans community, all of them were expected to be able to self-inject as prescribed. I told the trans clinic I should not be the one told to inject myself. The trans clinic did not care. The Department of Developmental Disability in New York was handling my health care at the time. The case manager at my healthcare agency tried a couple of things to find me a way to get my injections. I believe I was the first person to transition at the Department of Developmental Disability. First, my case manager tried to have a nurse come to my house. The home health agency said no, due to the fact that I was physically able to go to a clinic at the time to get a hormone shot. Next, my case manager tried to see if the primary care doctor would give me a shot, and the doctor declined. During this 6-month period, I was effectively in a state of detransition, even though I lived as a woman socially. Over the summer of that year, I wore pants all the time because I could not shave my legs because of the hormone imbalance. I had hot flashes, night sweats, and random nosebleeds after months of back and forth with my insurance, who did not care about my transition from the start. There was finally a clinic that agreed to host me for my shot every other week. However, when I actually got to the clinic, there was there was a series of miscommunications that caused a lot of problems. For some reason, my insurance did not communicate I was only there to get a shot, to just take the injection and leave. Instead, they gave me an intake, and I was having hot flashes the whole waiting for my shot. I had not consented to switch clinics. When the doctor came in, I was very confused because I was told two contradictory things. Because I came for injections, she would take over my hormones, yet she knew nothing about prescribing to trans people. And my current prescription was not even hers. So I ended up staying at the clinic for 2 hours when I should have been there for 5. After going through this twice, I realized that me being on injections was unsustainable. This is when I went back to the trans clinic and asked for more options. The provider suggested patches again, of which I said. This is when the provider brought up estrogen gel, of which I said okay to.
Estrogen gel is absorbed through the skin similar to the estrogen patch, but it gets absorbed more directly into the bloodstream than the patch.
I ended up moving to Texas. There was an LGBT clinic I reached out to after I moved to get hormones. After having one appointment, it turned out that they could not provide me with hormones because they only prescribed pills and they did not prescribe Lupron. I still had a small stash of hormones from New York, but as I started to run out, I became very concerned. At this point, I decided, although it was risky, I would start self-injecting. So I had a neighbor in Texas teach me how to inject myself so I could hold myself over for a month while I was looking for a solution. While while I was already on hormones for 3 years. This made me 3 years old and trans year. After a month of injecting myself, I found a provider in South Austin who prescribed hormones in gel form at their compound pharmacy because the gel hormone was compounded.
Compounded gel is a more personalized dose of estrogen. It is not FDA approved, and it has a lot of side effect warnings.
Just before I left for Israel, just before I left for Israel, I purchased a 6-month supply of estrogen gel in Texas, so I would have hormones in Israel. While I was in Israel, I went to the ER twice, and they thought my seizures were hormone induced. On top of not having health care due to not being an Israeli citizen, In order to get hormones in Israel, I would have to be legally transitioned, which I am not. I ended up finding out that the gel doses I did have was too low. It wasn't helping, and I still wasn't getting. I wasn't getting the physical effects other than my status quo. Throughout my time in Israel, I had no blood tests to check my hormones.
Not taking a blocker with estrogen causes a major imbalance in the body that is potentially dangerous. Some people's bodies become unable to make its own hormones due to the imbalance.
After coming back from Israel, I was in upstate New York for 1 month, where even though I was in communication with an LGBT clinic in New York City, the clinic did not understand where I was in relation to them, and the pharmacy in upstate New York had no idea how to distribute hormones. This is why I can never live in upstate New York. After a month in upstate, I moved to Florida. After only 1 month in Florida, I found an LGBT clinic where I got prescribed hormones. Out of all the places I have lived, New York, Texas, Israel, and Florida, Florida was the easiest place to get hormones. At this point, I was informed by the LGBT clinic that I could take the pill forms of estrogen and spironolactone by being able to crush them into apple juice to accommodate my inability to swallow pills, which no other clinic has been able to do.
The estrogen pill gets absorbed through the stomach and takes longer to get into the bloodstream than the gel. Spironolactone is normally used to treat heart failure and blood pressure problems, but is used to block testosterone off-label to trans women. The pill of spironolactone is absorbed through the stomach like the estrogen pill. 2 years later,
I've gone to the ER for migraines and stomach problems to no avail. I thought that me throwing up many times a day was due to me running out of my estrogen pills, and I was in between prescriptions for logistical reasons. After these failed attempts of going to the hospital, I almost died. After not eating for a week, I came to find out that I was in acidosis and would have been dead within hours if I had not gone to the hospital.
Dylan had metabolic acidosis. Metabolic acidosis is always fatal if not treated. Metabolic acidosis will cause the heart to stop. Acidosis is where you are not processing things correctly in your body, so your blood becomes acidic, and if it is not corrected, the person will stop breathing and die. In diabetics, it is called ketoacidosis, where their inability to make insulin causes their blood to become acidic and can kill them if they do not take insulin or other diabetes drugs to correct it regularly. Unfortunately, if someone is on estrogen, it makes the person more likely to develop acidosis because the hormone change causes the metabolism to change and the chemistry in the blood to change. Acidosis is more common in trans women than the general population.
My hormones are beginning to dig an early grave for me by making inroads in my liver, by making it engrossed in fat, giving me what is commonly referred to as non-alcoholic fatty liver disease. This is because in 5 years, hormones affect organ.
For trans males, this is usually when hysterectomy is recommended because the testosterone poisons the uterus and usually leads to cancer of the uterus and ovaries. Fatty liver is usually seen in people who are alcoholics and involves fatty deposits on the liver, which causes it to malfunction to the point where the liver can fail completely. Smoking can cause similar types of liver damage. Liver failure is when the liver doesn't work anymore and the person needs a liver transplant to survive because without a liver, all the toxins from your body build up in your blood until you die. Since Dylan has never smoked or drank alcohol ever in her life, the only reasonable explanation for Dylan's fatty liver is taking estrogen and Lupron. This is called non-alcoholic fatty liver disease. Do you plan on detransitioning at any point?
No, I am not detransitioning. I have gender dysphoria, but I support detransitioners. Most people who detransition are biologically female, but I am a biological male with a diagnosis that has been reconfirmed many times. I am not healthy enough to detransition. I am also not pursuing any surgery anymore. If I did pursue trans surgeries, I would most likely die in opera. What are the side effects of estrogen?
The common side effects of estrogen are heart attack, where the heart does not get enough blood flow, so it stops working, causing death if untreated, and a stroke, where the brain does not get enough oxygen, so it causes brain damage, and untreated can cause death. If the stroke is severe, it can cause a person to not be able to speak, be paralyzed, and be incontinent. I had a mild stroke as a baby, leading to cerebral palsy, so I can say from experience that the effects of a stroke are lifelong. Another side effect of estrogen is breast cancer. Taking estrogen makes trans women permanently infertile. Strokes and heart attacks are also common side effects of estrogen-based birth control. Please use any estrogen-based medications with caution.
Due to my precurlious anemia, that estrogen is more likely to make me have a blood clot that can kill me if I were to stop taking vitamin B12, and I would be more likely to die.
Precurlious anemia is a rare autoimmune disease where the immune system attacks a part of the stomach and intestines responsible for absorbing vitamin B12.
This is why I would recommend before anyone starts taking hormone replacement therapy that they should be genetically tested. I recommend that insurance companies pay for sperm banking based on the fact that Big Pharma has made you infertile. When I was 12 years old, in residential, they put me on Abilify, which made my hand shake. So to treat the side effect of tremors, they put me on propanol, based on the same principle as the medical establishment that prescribed me estrogen and made me infertile. So they should have to pay to make my sperm, at least for the disabled, since the disabled have a long history of having their fertility stolen from them.
What does the Bible say about transgenderism?
The book of Genesis says two things that are relevant here. God says to Adam in the Garden of Eden, be fruitful and multiply. If you take hormones, you cannot observe this mitzvah because you are infertile. And in the Talmud, this is grounds for divorce. The second issue in the book of Genesis that is relevant is when it says in the book of Genesis, God made man in his image, in the likeness of male and female. This means that God intended for male and female bodies to work in a certain way. We reject what God gives us by putting the opposite sex hormone in our bodies. Overall, transitioning medically is a violation of natural law because human nature is not meant to function this way. The science conclusive on the efficacy of transition.
No, it's not necessarily conclusive. Many scientists are not convinced transitioning is ethical because of the many complications. Science has concluded that gender dysphoria is a real condition that is very serious and requires treatment, but some scientists are alarmed by the lack of study on the long-term physical and emotional effects of transition and feel we should be looking for more treatment options.
Are cross-sex hormones healthy for the body?
Each person's body is unique, so there may be some situations where, depending on a person's condition, hormones may benefit that individual. However, I think for the majority of trans people, cross-sex hormones do more harm than good. In someone who is meant to be genetically one sex who takes cross-sex hormones, it creates a major imbalance in the body that can change the shape of organs affecting their functions, including change the shape of the heart, which might have deadly consequences. Cross-sex hormones have been known to cause brain damage, particularly in people younger than age 18. It can cause changes to the genital areas that can cause damage to these areas. There is always a risk of cancer when using hormones. In people with certain mental health conditions, the hormones can cause mood changes and worsening depression.
How is intersex different from being trans?
Intersex is an entirely different condition with the baby possessing a mix of both male and female sex chromosomes, resulting in both male and female sex organs. Trans people generally have normal sex chromosomes and take the hormone associated with the opposite sex chromosomes, creating an imbalance. An intersex person has different health needs than a trans person, so their bodies will react differently to hormones and treatments.
Are trans surgeries safe?
Generally, no, depending on the person. The surgery, vaginoplasty, starts with the brutal process of removing the testicles. After this neutering, the scrotum is removed. After the scrotum is removed, the penis is then used to create a false clitoris, which is an open hole meant to function like a vagina in theory. The phallus gets inverted and turned into a vagina shape. The hole that looks like a vagina is very risky to create because the penis has a lot of blood flow going to it to help a biological male achieve intercourse. But this means that a person can bleed to death very, very easily during or shortly after the surgery, and there are many documented cases of trans individuals bleeding to death as a result. If anybody plans to have this procedure, they should get tested for bleeding disorders first. In the event that you survive this surgery, the trans person must dilate the hole, and if they don't, the hole will close, and if the hole were to close, it could become difficult or impossible to urinate, and this can be deadly because of toxins that build up in the body from being unable to urinate. Other complications include a lack of sensation, difficulty with sexual intercourse, and unexplained bleeding from the area, rectal damage, and scar tissue.
Are there any other trans surgeries?
Unfortunately, yes. Phalloplasty is a surgery that is an extremely dangerous procedure. It is done in many stages. The first stage is deciding where to take a skin graft from. The surgery involves taking a skin graft from a thigh or forearm to create a false penis. During this stage of taking a skin graft, the person can die because the graft area never heals properly. Some people bleed to death, and others have a bone sticking out of the wound and raging infections. Once the false penis is created, it is put onto the vagina and a urethra lengthening is performed so the trans individual urinates standing up. The false penis tends to look like a weenie. The second stage is to put in silicone balls. The final stage is where a pump is added to pump air into the false penis to achieve an erection.
Hormones are extremely dangerous, and I hope this video spearheads better treatment for gender dysphoria than the current treatments, which are deadly.
Dysphoria is a real condition with a biological basis to it, and people deserve a better treatment for it that doesn't lead to life-threatening, lifelong health complications.